want to shift to the weekend marking 20 years since the terror attacks on 9/11. So many are still mourning those that we lost, and some survivors are still dealing with physical and mental effects from that day. ABC's Rena Roy explains how one federal program is helping survivors move forward.
I was sitting here reading my paper when I heard that noise.
It's the deafening sounds and the sudden screams for help that even 20 years later, Doris Denisard still can't shake.
The sound was unbearable. I said to myself, my God, that plane is flying awfully low. When I looked down, I heard a crash.
The scenes from her lower Manhattan apartment just blocks from the World Trade Center.
And people were running and running that way. And the second plane came this way.
Replaying in her mind every day, especially come September.
When I came out of the lobby, I saw the tower burning. I started to scream and I said, people are jumping, people are jumping. A policeman stopped me. He says, you can't go back to your house.
Denisard stayed with a friend for over a week before coming back home to a neighborhood forever changed.
So when you got back to your apartment, what did it look like here?
Oh, it looked like white. It looked like snow, but it was dust. So I said, I'm going to clean it.
And she believes that cleanup of toxic dust did some major damage. 3 years later, 2 bouts of pneumonia revealing breathing issues linked back to 9/11.
And sure enough, they found something in my lungs. They found out that I had COPD.
Denisard paid thousands for medication over the years out of her own pocket until she got a letter in 2015 explaining she was eligible for the World Trade Center Health Program, which offers free health care for 9/11 related conditions. Hispanic Federation President and CEO Frankie Miranda is working to reach more survivors in hopes of getting them the help they need.
They always suspected that something was wrong and that there was something that really triggered these symptoms, but now to be able to connect it to what happened to them mentally and physically, it is really transforming lives.
The Federation estimates about 400,000 people were here in the downtown New York City area that day and in the following weeks, and may have been affected physically or mentally, but only a fraction of them have taken advantage of the program.
The program also offers resources like therapy.
It really did a number on me. I'm suffering from panic attacks and depressed and anxiety.
And as we remember 2 decades later, a reminder there's still a long road ahead for so many in this country.
Of course, we don't want to forget, but it's like I say, if you have a cut and somebody keeps doing that, it never heals.
Rena Roy, ABC News, New York.
All right, our thanks to Rena Roy for that report. And for more, let's go now to former NYPD officer Reggie Hilaire. He spent over 850 hours at Ground Zero and the Staten Island landfill that wreckage from the Ground Zero went to, doing security and searching for remains. We also have Dr. Michael Crane with us, medical director for the World Trade Center and clinical center at Mount Sinai Medical Center. Thank you both for being here. Reggie, I'd like to start with you. I know you spent months after the attacks helping in the rescue and the recovery efforts and the investigation. It's been nearly 20 years now. How do you feel looking back 20 years later?
Well, it feels like a lifetime ago, and also it feels like yesterday. There are certain things I remember clearly and certain things I try to forget. But certain things, like especially that day, I remember how clear, how beautiful it was. And it's still, I'm 50 years old. I was 30 then, but it still feels like yesterday.
And I know that in March of 2005, your wife discovered a lump on the side of your neck. You received a diagnosis of thyroid cancer at 34. And not long after that, an additional diagnosis of multiple myeloma, some blood cancer that's now been dormant in your system for 15 years. What's that journey been like since those days at Ground Zero, and then following how your health has been impacted by that day, along with so many other people who were there that day?
It felt like different phases. The first phase was, of course, the birth of our son. I was more concerned about that. Then when I developed flu-like symptoms a month after he was born, that picture that shows up, very significant, because I didn't want him to get sick. So normally I would have blown it off. but my wife discovered a lump when she was pregnant. I decided to go. And the first phase was thyroid cancer. It just hit you really hard. You didn't know what to expect. And then when they did the surgery, the radiation, that's when we breathed a little bit better. And then had to go back to my primary doctor who discovered I was anemic. He referred me to a hematologist, did a bone marrow biopsy. They said it's multiple myeloma. I just couldn't believe it. Like another one in less than a year. So that was phase 2. Then phase 3 was going to Memorial Sloan Kettering Hospital, Manhattan. They said they confirmed it, and they said they can't do anything now because it's asymptomatic. So I thought, okay. They said within, on average, 2 to 3 years, you become symptomatic. Then you enter a different phase where it's just felt kind of numb, maybe depression. And that was probably the darkest period where I felt almost blame for going there, but also felt like that was my job. I had to do it. So finally it became acceptance after months of going and nothing happened, and just felt like, okay, everything's unclear. So finally the acceptance phase, it is what it is. And thankfully 15 years later, it's become asymptomatic. So I'm really grateful because I knew others that passed away from the same type of cancer I had.
And we are so glad that it is dormant right now and that you're doing so well. Dr. Crane, as Reggie mentioned, not everyone's been so lucky. According to the CDC, at least 2,833 first responders and survivors have passed from illnesses related to being on the site that day. What's your experience been like seeing first responders dealing with these medical implications after putting their lives on the line?
Well, first of all, I just want to salute Officer Hilaire, who's obviously, a courageous gentleman. And I have to say, he is typical of the type of folks we see in our program. They're brave, they're altruistic, they're self-giving, and they deserve everything we could possibly give them in terms of medical care. The story that the officer is telling is not all that unusual. There are numerous cancers that develop in World Trade Center responders, and certainly blood cancers and thyroid cancers are among them. And the thing that we're grateful for is that the Zadroga Act gives us the capability of responding and treating those cancers, and then continuing to monitor a program members over the course of years. I want to point out that just recently there's a paper that's come out that has kind of underscored the importance of the program and the success of the program in reducing cancer mortality and improving the survival of cancer patients. And that's in part attributed to the fact that we're dealing with a previously very healthy population. I mean, Officer Hilaire still is a very healthy-looking guy, and they have tremendous internal resources, obviously a supportive family, and that's all very important. But I think the program also has really contributed to the longer survival of these patients. And again, this is one brave man you're sitting with today.
Oh, that's for sure. And Dr. Crane, do you expect to see more 9/11 related long-term health effects down the road different from what we're seeing now? How do these people move forward?
So I think, first of all, I highly recommend that all responders come to the World Trade Center program. We probably have about 90% now enrolled, but every responder should come in, and so should all survivors take advantage of the program, the community program. We do expect the prevalent illnesses to change a bit. We're not exactly sure what is coming. However, we are prepared, just like we were prepared in meeting cancer, to deal with whatever the responders bring, which is related to World Trade. And I think that's the real strength of this program. It has an enormous flexibility built into the Zadroga Act that allows us to really respond to what is going on with our populations. And again, we have these tremendously courageous people like this officer who really make us want to work as hard as we can for them and for their families.
Yeah, no lack of motivation there, I'm sure. So, Reggie, 20 years later, how do you and your colleagues cope with this idea of being heroes, knowing you saved lives that day, but also knowing that you put your own lives and health on the line to do it?
Well, we just accept that's what we signed up for. I must point out that looking at the previous report that you guys just aired, it's still kind of shocking that people are not getting checked out. I remember when I was diagnosed, I was very vocal in my precinct, everybody that worked down there, to get checked out. And you just get this blank look. I had no problem talking about it. I thought, hey, if I can help get people checked out, they should. People didn't want to get checked out. They were afraid. These are some of the bravest people I've ever met working with me in the police department. But in terms of their own health, they were kind of scared or kind of downplaying it. And even just normal people, relatives, friends, that I always say, and when I talk about 9/11, I can silence the room. When I say that I had cancer from 9/11, I could clear a room. To this day, still people don't want to get checked out. If you were down there, even for a first responder, if you were just working in the area or just passing by, get checked out. It can't hurt, especially now that the Zadroga Act was passed. It was really hard for us, especially those without health coverage. But now it's covered. It's kind of a little hard, but there's no excuse for it now, 20 years later.
All right, Officer Reggie Hilaire, Dr. Michael Crane, it's great to have you both. And again, thank you both for the work you did and the work that you're doing.
Thank you. Thank you. Thank you very much.
And you can check out the ABC News 9/11 special, The Longest Shadow, streaming on Hulu right now. ABC News will also have live coverage of the anniversary of 9/11. 20 years later, America remembers. That's this Saturday at 8 a.m. Eastern right here on ABC News Live.
Hi, everyone. George Stephanopoulos here. Thanks for checking out the ABC News YouTube channel. If you'd like to get more videos, show highlights, and watch live event coverage, click on the right over here to subscribe to our channel. And don't forget to download the ABC News app for breaking news alerts. Thanks for watching.